gut health. And let me get back in here. Hold tight. Reshare. Stop and reshare for us. All right, hang tight, hang tight. I want to share that there. I lost it. All right, here we go. And let's go. So just a couple notes as we start the webinar. So this is educational and it's not giving any specific medical advice or personal advice. So it's strictly educational. And it's not establishing a provider-patient relationship. So for those of you who know me in the clinic, we can talk when we are at our sessions, but this is not specific for anything for anybody right now. And any comments, especially at the end with any questions, just know that other people may see them. So just you need to know about that. And I'm recording this for future use and we'll have questions and answers. So as we go through this, please take some notes. And at the end, I am excited to answer any and all questions that you have. The objectives of this talk is we're going to talk basics of functional medicine. We're going to dive into cellular health, dive into diseases and symptoms of inflammation. I want you to understand some of the drivers of inflammation, especially with regard to leaky gut. I want you to understand how gut health can drive food sensitivities and therefore further exacerbate inflammation. And then we'll talk about how to reset the gut and how to identify some of the personal triggers of inflammation and enhance your cellular health. So I'm Jennifer Tootie Shepherd. For those of you who don't know me, most of you do. And my journey into where I'm at as a healthcare practitioner is long and beautiful. And I started off as a traditional physical therapist. I almost left the profession 2 times because I just was very disenchanted and frustrated with how unequipped I was to help my patients with pain, recovering from injuries. I just didn't have the skills or tools in order to help people. I was very nice to help people. I was very nice to people. Some people got better, some people didn't, but I just struggled. So fortunately, I met one of my fantastic mentors, and this mentor really taught me how to be curious about the human body, to ask questions, and to think outside the box. And in so much of healthcare, we're put in boxes and we're really not allowed to explore or think outside of the box. So that really opened up the doors for me to be able to be curious and help more patients and ask more questions because the human body is amazing. It's brilliant. And there's so much we don't know about it. But as we ask those questions, we're able to help people so much better as we dive into the anatomy and the physiology and how people move. That mentorship further went into visceral, vascular, and neural. And that is where now we go inside of the container and trained hands and a knowledge of anatomy and physiology enable us to go further into and help people with their organs. So injuries come into the body, organs get stuck. A trained hand can come in and help free up those organs and help those organs work better. So that opened up the door into, as I was treating patients with pain, as I'm treating these patients, sometimes other things would show up. Well, hell, we've got some back issues. Well, things are really sticky down here at your pelvis. Let's talk about your gut. So then that would open up the conversation into, hey, what else is going on here in this person? Because this person is a whole person with a whole history of everything that's gone on. And I'll say this many times throughout the presentation, there's never one thing going on. So you come in for whatever you're being treated for, but as we go into the body, maybe there's a little something going on in this system, a little something going on in that system. And that's what I started to notice in my practice is, hey, there's other things happening in my patients. How do these other things affect what I'm trying to help them with regard to back pain or GI issues? That further curiosity took me into becoming a certified practitioner in functional medicine, which we're going to talk a lot more about in this session. So my why actually really started with my mom. She's over there on the right. And I lost my mom to Alzheimer's disease in 2022. She was diagnosed in 2015. And it was after a short bout of breast cancer and chemotherapy, and she really never bounced back. And in functional medicine and in my practice, we talk a lot about the concept of allostatic load and body burden. And often what happens is things happen to the body over a lifetime, and then the body gets to a place where it says, I can no longer adapt. There's too much inflammation, there's too much strain on the tissues, there's too much adaptation, and then I've run out of room to adapt. And then the body starts to tip into disease. And as we look at some of these chronic diseases, we can look back and see here's how they got there. So I wanted to learn everything I could about this disease of Alzheimer's. I started to read Dale Bredesen's book, The End of Alzheimer's, and started to study Dr. Perlmutter, and both of them are big proponents in the functional medicine world. And back to that concept of here's a disease, and most of medicine just wants to can make this disease go away. But in functional medicine, we dive into, well, how we get there? Who are all the components? Who are all the players? What systems are involved? Because humans were created as a whole unit with all of these interacting systems. So that started my curiosity of number one, how could I support my mom? But even more importantly, or the same, I was concerned about my own self. And I said, oh my gosh, I've got 20 years till my Alzheimer's kicks in, because we know that there's a very strong genetic component to Alzheimer's. So I wanted to, how can I keep myself as healthy as possible? And I thought that I was keeping myself pretty healthy. I was always into exercise and trying to eat healthy, what I thought was healthy. But I still struggled. I struggled with GI issues for a long time. I struggled with some anxiety and depression. I've always struggled with weight. So there were still some underlying pieces that I couldn't quite put my finger on, but I knew I needed to get on top of if I didn't want to go down that road that my mom went down. About the same time as my practice is evolving, as I'm treating more complicated patients, my patient Christina, and she gives me permission to share the story. She came in probably just around after COVID, and she had bilateral knee pain and had seen many doctors who wanted to do medications and injections. And really, that's what's in their toolbox. And she didn't want to go down that route. So fortunately, she found me. So I take a look at her. I go through her whole intake, her history. I look at what she's eating. That's a big part of the intake. Her stress level is high. She's said she struggles with weight. And as I treated her that session and I took in all of her history, what really stood out to me, because she also had some other systems that showed up that she struggled with, but inflammation is really what was very, very obvious to me. And I told her, I said, I'm very, very good at what I do, especially with my hands, as far as mobilizing, helping your body work better. I said, but I'm really sniffing out chronic inflammation in your body. And no matter how good of a job I do, I really strongly feel this inflammation is going to be in the way. It's going to slow our progress down, and it's really going to get in the way of me helping you optimize your body. So she jumped on board right away. She was ready to make some changes in her diet. I didn't know about the elimination diet at the time, but she was willing to start. Let's try gluten-free, because gluten actually is it's pretty big, a subtle inflammatory contributor to many, many people for many reasons, even if you're not celiac, and sugar. So she cut both gluten and sugar, and I, helped her get through it. And it really is a learning process sometimes to find alternative foods when you are changing your diet. But the exciting part is she was on board, she asked great questions, was that her knee started to feel better, and we hadn't done a lot of mechanical treatment. Even more important was when she would consume some sugar or she'd eat something with gluten, and she'd notice very quickly how her knees started to hurt. So that was so very important for her to develop that awareness of, wow, these foods really do affect my body. So that has helped her stay on it and even start to eliminate more foods and really make so much better choices in her body. And over the years, as I've watched her, I don't treat her very much at all anymore. And that's always my goal, to get people to a healthier state where they don't have to be treated as much as they did initially. But just to watch her just grow in her confidence. She's gotten into the gym, she's lost weight, and she's even had better relationships with her family members. So the power of food is so, so important in so many ways. I started the foundations for functional health just in this past year. And as I'm treating patients, I'm doing a lot of work with my hands and helping restore the structure and, problem solve, restore the structure. But there really were some pieces that I wanted to further educate my patients. And I didn't want to spend that time in the clinic because I wanted to use my hands. So these were things where I could teach them to do these things at home. And that's what I want. I want to teach people how to fish. I want to teach them how to be independent with taking care of themselves instead of being dependent on me taking care of them. So it's definitely a relationship of taking care of yourself and me supporting you along the way. But I've developed four courses, and one of them is the structural health course, in which we deal with optimizing the health of our body, our structural body, as far as length and tissue mobility and deep core stability. So, optimizing our function, and then that can set us up to be healthy in the gym and then in all the activities that we do. Cellular health is what we're talking about today, as far as inflammation, which I see so much in my clinic. We go into detoxification. A lot of my patients, genetically, we struggle with super strong livers, and just sometimes genetics, we're missing the enzymes to break things down well. So it's another area where we dive into, it's not detoxing, but it's how can we support the detoxification system. And then we also go into nervous system health, which is the autonomic nervous system, which is your sympathetic and parasympathetic, your fight or flight. So all of these together, I feel these are the four important components of being human and keeping our bodies healthy. Today, we're talking about cellular primarily. So functional medicine started back in the early 90s, and a couple of doctors just frustrated with the tools they had in their toolbox, primarily medications, and their patients really weren't getting better. And they were smart cookies. They were asking questions. They were curious, and they started to ask why. And that's where my mentor started to teach me how to be curious and ask why. What's happened here? What are we dealing with all of here's these symptoms, but what's contributed to the symptoms that somebody's dealing with? So it's a system-based approach where we're looking at the circulatory system, the nervous system, the gut system. We look at the skin. We look at all of the systems that make a whole body, versus a lot of conventional medicine is just looking at symptoms. So here's a symptom, you've got stomach pain, here's a medication to make it go away. Instead of, okay, what happened here? Why is the stomach having pain? And maybe there's something else. So as we look at systems, there's never one thing. And if one system is burdened, it's going to put a strain on the whole body and will strain some other systems. So sometimes that place of pain isn't the first place that we need to look at. Maybe we're not looking in the right place, because have to look at the whole body. And back to symptoms, I feel a lot of traditional healthcare providers, let's just throw something against the wall and see if it sticks. Or here's your lab, here's a medication for your lab, versus what's going on in this whole person. The beauty of functional medicine as well is the timeline. What's everything that's happened to you throughout a lifetime, and how has your body adapted to it? That's what I've seen, especially as I've been studying and treating patients with Alzheimer's more and some really complicated issues. Okay, what happened when they were young? What were the foods that they ate? Was there a lot of antibiotic use that can affect the gut? Was there trauma? Was there emotional trauma? Were there injuries? Were there surgeries? When did medications come in? And it's fascinating. A medication came in for maybe thyroid. And then a few years later, then you saw the heart disease start to come in. So as you map out a lifetime, you can see here's how somebody ended up here at age 60 with some of these diseases, when you start to unpack and how the body tried to adapt for every single thing that happened. And even medication can cause some unintended consequences where the body has to respond to that. Genetics is a big player. We can't help the cards that we've been given, but we can support those genetics with taking care of ourselves and keeping inflammation down. I have a gene for high cholesterol. And it's what's really, really cool is, as I have my labs done, I haven't tipped that gene yet. I haven't tipped into high cholesterol where my brother has. So I'm grateful. I think it's a testament to just the work I've done to take care of myself, keep my inflammation down, and keep my body healthy. In functional medicine, primary tools for helping patients are teaching them how to take care of themselves. We do dive into labs and supplements. That tends to be where a lot of functional medicine tends to go. But the most important things are, as I mentioned in the pillars, we're dealing with nutrition, we deal with stress, help you with sleep, movement, and environmental toxins. And as we address all of those pieces, most of the time we can get to the body into a better state of health, a better state of balance. So it's all about treating the whole person. Cellular health, our cells, these little microscopic cells that we learned in elementary school that do so many processes all the time that we are not even aware of. They're the building blocks of everything and every process. They're the building blocks of our tissues, of our organs, of our muscles, everything. And They require nutrients in order to be healthy. If we did not eat, we wouldn't have all of the vitamins and minerals to support our cells for them to do their job well. And that's where we get into trouble is when we don't get the adequate nutrients for our cells and or we're consuming things or being exposed to things that create more strain and stress on the cells. Most of our nutrients, proteins, fats, and carbohydrates, and vitamins and minerals and colors. So I think it's a brilliant design, our bodies and nature and how we eat with the seasons, the different colors support different functions throughout the season. I think with regard to citrus fruit comes into season around the winter time, and that's really when we need more vitamin C to fight a lot of those viruses that tend to happen in the winter. So as nature intended is what I often say as we dive into how we take care of our bodies. Eat food, not too much, mostly plants, is a quote from Michael Pollan. Unfortunately, we live in a society that does not support healthy eating and growing our own food and eating with the seasons. It's a fast-paced society. We've got processed foods. We're on the move. Today's farming practices are not what they were before. There's more toxins used as far as pesticides and fertilizers. And there's fewer nutrients in the foods that we eat today, and they're shipped across the country. The white sugar, our bodies were not designed to handle the sugar intake that is in most processed foods and all of the white refined flour that we see in baked goods and such. The meat practices tend to be high in omega 6s, and there's also so many refined oils in our diets today. As we get into the omega 6 land, we'll talk about omega 3s, but omega 6s tend to be more inflammatory in the body. Processed foods, you start reading ingredient labels, and there's just a lot of junk that our bodies weren't designed, our cells were not designed to handle. And then we can't not talk about the concept of big food because it's out there, all of those big corporations that like to say our food is very healthy, but then you start to read the labels and you see how sugar is listed very quickly, or maybe sugar is hidden under a different label. And truly, truly, a lot of those foods are packed with sugar, fat, and salt, and they create these addictions that we just want more and more at the expense of the health of our bodies. Nutritional deficiencies are huge, just from what I had mentioned. Sometimes genetically, we are missing some components where we can't break down nutrients into an absorbable form. Our diet is a big player. Stress can create nutritional deficiencies, medications, those unintended consequences. Statins are a big contributor to nutritional deficiencies, especially with regard to CoQ10. Other medications can deplete various vitamins in our bodies as well, and leaky gut. And again, when we don't have the adequate vitamins and minerals, our cells can't do their job well and they struggle. Chronic inflammation is everywhere. It's very, very common in my clinic, and it's not really obvious at first until you start to point it out and you start to call it for what it is, because many of us are in a state of chronic inflammation and we really don't realize it. So inflammation is a natural body process, right? You get a virus and your cells start to, all right, get everybody on board. Let's attack this virus. That's inflammation that we want, right? We spike a fever because we want that heat to kill the virus. So the body has all of these brilliant ways to protect ourselves from invaders, to repair when we have damaged tissue. However, the world we live in with all of these processed foods and toxins and stress tend to create that state of inflammation all the time. So the body never gets a break and it's always in that state of fighting. So in that constant inflammation, it does result in cell tissue and DNA damage. As we mentioned before, the components, food components that contribute to inflammation are the refined foods, high omega 6s and chemicals, toxins, stress, and intestinal permeability and leaky gut, which we will talk about. I talk a lot in the clinic about toxic soup because I'm working with your tissues, I'm working with your organs, I'm working with your arteries and nerves with my hands. And sometimes I can feel, hey, things are a little sticky, things are a little stiff, things just feel a little hotter. So I'm not treating someone's arteries directly, but often as I treat people with back pain and hear some of these comorbidities of cholesterol, pressure, family history of heart stuff, and we can feel, hey, there's some tightness through these tissues. What's the inflammatory level and what's the health of the cells that are making up these these arteries and organs and tissues. Nerves, I see quite a bit, right? As far as nerve pain and tremors, and when nerves are irritated. So I think about here's this chronic inflammation in the body, just this process that's always happening, and just the extra heat that's coming from it, extra debris from all the byproducts of the cells doing their job. And it just creates a toxic soup. So that's how I tend to explain it. Here's your nerves, and they're just in this toxic soup, which is not a very healthy environment for them to do their job well and efficiently. In the organs, you hear about fatty liver and brain health. I think about, all right, what's going on? What's this underlying toxicity, this underlying inflammation that just is not supportive to the tissues and the cells? We get into joints. Absolutely. There's almost always mechanical things involved as far as the structure that drives joint and joint degeneration. But what really makes things go faster, especially in the case of osteoarthritis, is inflammation to those tissues. That's a plate of spaghetti. I use that analogy when I talk about fascia. And when everything is healthy and good, things slide and glide like a plate of oiled spaghetti. So when things get kind of dry and sticky from inflammation or residue from inflammation, things just get stuck together. So when your body tries to move and your organs are trying to do their job, things just get kind of stuck. And then it's my job to go in there and try to free things up. But at the same time, we really need to improve the health of the cells so they can do their job better and they can heal. So much, so much, so much, so much of our health issues today. Inflammation is such a big component. Autoimmune disease, genetics are a very, very strong component of that, as is a leaky gut, but inflammation is a driver. Cardiovascular disease, cancers, GI diseases, asthma, depression, and anxiety, metabolic diseases, the diabetes, neurodegenerative, chronic pain, the commonality is inflammation. And as everything we've talked about, here's all the components that drive inflammation. It's frustrating because there's so much we can do. But as we dive into how it's being dealt with in our medical systems, they're really not dealing with inflammation. Again, the systems were designed. We look at labs and we treat with medications, which medications come in and they're not addressing the whys and the inflammatory load. Or maybe here's a medication to deal with your inflammation, but as we know with medications, they can cause unintended consequences. They can burden the liver. And this is not to say, if you're on medications, please stay on them and work with your doctor. But often the medications aren't always dealing with those original problems. They're just dealing with symptoms, but they're not dealing with the inflammatory component. Very, very few doctors, as I worked with my mom through her journey, nobody talked about, hey, what are you eating? How are you staying healthy? How are you bringing nutrition into your body? And in fact, I sent her to a hospital nutritionist, and what came back it was focused on calories, and it had ingredients that had Splenda, which we know those artificial sweeteners are full of chemicals and are toxic to the body, to the liver, and to the gut. So that's not a healthy way to approach eating. And then, or they say, hey, find someone to help you with weight. And people I've worked with who've done some weight programs, I'm looking at the foods that they're eating and they're processed. And there's a lot of extra junk in these weight loss food bars that actually contribute to more inflammation, which is a big driver of why they're struggling with weight in the first place. Weight Watchers, you focus on points and calories, and often they do a lot of dairy. Dairy is pretty inflammatory to people. So our medical systems aren't set up to really help people deal with addressing inflammation and doing it efficiently. In the clinic, as I mentioned a few times, I'm just going to skim through this. I see comorbidities. So I'm seeing a patient for one thing, and I see all these other components as well. And it just makes me think, hey, we've got some other pieces going on that we need to address the whole person. And some of those, the high cholesterol, high blood pressure, that's not my scope to treat. However, we do know that inflammation is a big driver underneath there. And hey, maybe if we made some diet modifications, let's talk about some of these things. And perhaps you can decrease some of these other health issues by addressing chronic inflammation in your body. Hormone imbalance, I see a lot of endometriosis, which is a huge inflammatory component, and we need to dive into liver support as well. Migraines, anxiety, depression, eczema. As soon as I hear skin issues, it takes me very quickly to inflammation, and especially with regard to leaky gut. Right next to that is the medical systems questionnaire I have all of my patients fill out. And on our home site for the Foundations for Functional Health, there is a link for you to take the MSQ on your own as well. And I think it's really important to take because it's just a good place to check in to see how am I doing system wise and what is you get a number at the end. And sometimes my number goes a little bit higher when I haven't been eating as well or I haven't been exercising as much. So it's hard to stay super clean all of the time, but I think it's important to check in with that often just to see, hey, am I trending in the right direction? Am I trending in the wrong direction? And it's great to track your progress. Symptoms I see that make me start to think, hey, what's going on inflammatory wise? What's going on gut wise, which we're going to talk about in just a minute. But tongue coat, dry skin, I think about nutritional deficiencies with ridges in the nails, dry skin, we're low in omega-3s, sensitive irritable tissues, as I talked about irritable nerves, what's going on, nutritional deficiencies and or inflammation. Unreproducible pain when it's really hard to put your finger on what is it. This is much more than mechanical. There's some other players that contributing it to it. Painful periods, any GI stuff we'll dive into. Allergies take me very quickly into we probably have a gut issue. Poor immunity takes me to a gut issue. Slow or no response to treatment. Again, like I said, we're really good at what we do in the clinic, and some people respond well. Some people we move a little slower. And that's when we hit the pause button and say, hey, what else is going on? Let's look closer at what you're eating. Let's look closer at some of these systems and some of these biological processes that maybe we need to explore. Maybe we need to dive into genetics and see, what are some of the missing pieces that we need to address to help your body, to help your cells work as optimally as possible. Or when I'm treating somebody and the symptoms keep coming back, we need to dive deeper into inflammation, nutrition, and gut health. So gut health. I have a long story of gut health, which I will come back to it a little bit later, but I'm grateful for where my gut is. I've struggled with gut health since I was little. And it's made a lot of sense because I've struggled with GI issues and pain and hormone issues and anxiety and depression. And as we learn more about gut health, leaky gut, and the microbiome, a lot of that makes sense. That this gut issue I've had for the longest time has been a big contributor to my health issues. And as I've started to address it personally, I feel so much better. So our guts, it's our nutrient absorption, it's immunity, it's the second brain, the gut-brain axis. It affects our brain health and the microbiome. It's that balance of the bacteria in the gut. So leaky gut is what I want to really spend some time on. There's a lot of talk about gut health and leaky gut. And everything we talked about there on the left can contribute to leaky gut. But what is leaky gut? So you see that picture there in a healthy gut. Those cells are packed next to each other and they provide this barrier. They're letting just the right things go out and in. When you have those spaces in between the cells, toxins can get from the gut into the bloodstream. Food particles can get from the gut into the bloodstream. So what happens, so that all of that in turn creates more inflammation, creates immune reactions, and contributes to disease. But I want to stay here with this one. Sometimes food particles can get through the leaky gut and into our bloodstream. And then, say, for example, you ate some chicken, you were in a state of leaky gut and you ate a whole bunch of chicken and some chicken particles got through. Your body says, hey, this isn't supposed to be there. I'm going to develop antibodies towards this chicken. So then the next time you eat chicken, the body says, oh my, there's an invader here. I need to create that immune response and I need to create that inflammatory response to fight against it. So that's how we start to develop allergies and sensitivities. So allergies are a little bit tougher of a conversation. It's still, we're dealing with the same mechanism of leaky gut being a driver. So, I mean, allergies, so many of them are life-threatening. So we are very, very cautious and careful with those. But many, many, many of us have food sensitivities. And it's still an immune response where little food particle has gotten through your leaky gut and the body says, hey, that's an invader. I need to create an inflammatory response. The interesting thing is many of us are already in a state of inflammation, that we are consuming foods that create inflammation and we don't even really realize it. And that was the case for me. So we have our obvious ones for sure, right? Sugar, refined foods, oils, and alcohol. Those are really rough on gut lining. and can create irritation. But dairy, gluten, eggs, corn, soy, shellfish, those are some of the big sneaky ones. Sometimes dairy, I think, is obvious. A lot of us have intolerances to dairy because we really weren't designed to consume cow milk, baby cows were. So our digestive systems weren't really set up to handle that. And usually we know right away, like you drink dairy and you're like, wow, I'm really gassy afterwards, or I get really bloated afterwards. That's a food intolerance where it's really obvious right away. But like for me, for gluten, I was told to go off gluten and I went off gluten and I really didn't notice very much. And it was hard to go gluten free to make those big changes. Granted, as I went gluten free, I was also eating food that had sugar and all of these other processed foods because just because you're gluten free doesn't mean that you're eating clean and healthy. But for me, there were other hidden food sensitivities that were still contributing to inflammation. So I didn't really notice the impact of when I went off gluten. I'm like, well, that didn't work. And so I just let it go. And I feel like that's common. Like I went off gluten for a little bit and it didn't do anything, or I went off this and it didn't do anything. So back to just for a moment, what are things that tip me off into someone have a leaky gut? I had a woman who I was treating for some other issues, and she really needed a knee replacement. And the doctors would not do a knee replacement until she lost another 40 pounds. And she was really struggling. She was working so hard and doing such a great job to do it, but she really struggled. I said, I have a hunch, there's probably some underlying inflammation. Let's see if we can knock out any other inflammation in your body just to help your cells work better and work more optimally and see if that can help your body shed the rest of this weight. So I'll tell her story in a little bit. When I hear poor immune systems, aches and pains, chronic pain, low energy, mood, hormones, disease, skin issues, all of those make me start thinking about leaky gut. And could there be some hidden food sensitivities? That's my friend Natalie. We take courses every couple years, and this is where we've learned a lot more about how we help the digestive system with our hands. So the elimination diet, and as soon as I see elimination diet, I feel like people want to run for the door. I don't like the term diet. I was on diets forever. When I was little, diets don't work. And then you hear the term elimination. Oh my gosh, I have to give up stuff. What do I have to give up? Don't take my food away. Don't take stuff away. So the elimination diet, and that's why I don't love the term of it, but it really is hitting the reset button. I fought the elimination diet for a long time as well, even as I went through functional medicine. And I had already given up dairy. I'd given up gluten because I'd done a blood test for it. I'd given up sugar, and I was doing pretty well, but I still struggled with some pieces. And I just had felt like I'd given up so much. What more can I give up? But I had appendicitis a couple of years ago and was drinking a little too much alcohol. I had too much fun in the summertime. And my doctor, who follows me really closely, she's like, you just need to clean house and you need to do it. I'm like, finally, let's do it. So I signed up for her program and I was grateful. I paid a lot of money for it, which I needed to. Like, I needed to invest that money into it to keep me accountable versus I'd done some things in the past. I'd done Whole 30 in the past, and then I kind of just made it to like 17 days. I'm like, oh, I'll have that glass of wine. So committing to it financially and then having accountability was really important for me. But I was really, really, number one, how good I felt when I cleaned house and really eliminated a lot of these extra foods that we'll talk about. And then what was most eye-opening was when I started to reintroduce some foods. So it really is hitting the reset button. So we're going to clear out the unhealthy oils, the sugar, the alcohol. We're going to eliminate some of those common offenders. And there still is a lot of stuff to eat. I promise you that. You will never be hungry. And in fact, many people have more energy because we're consuming more nutrient dense foods and healthy fats and lean proteins. But it takes 21 days for the body to rid itself of the antibodies that were created to fight these food sensitivities. So we hit the ground running for 21 days. And then at the end of 21 days, and this is what's most important, is the concept of reintroduction. Because I've had people do elimination diets, or I haven't done them, but other people have done them, or they've come to me, yes, I did it. I said, well, how is your reintroduction? Because that's when the rubber hits the road and the magic happens, is when, okay, we've leveled the playing field. Most people are feeling better as far as their symptoms. We're journaling and keeping track of things, but then we start to introduce, and very quickly you consume it first thing in the morning, and then you consume it at lunch, and then you consume it at dinner. And you'll know pretty quickly if that food is irritable and inflammatory to you or not. And unfortunately, sometimes it is. Wow, that first food I tried eggs. Darn it. I got really, really irritated in my GI. So I had to let that one go. But I was grateful to know that, hey, here's a food that is inflammatory for me. So I don't want inflammation in my body. So I'm going to let that food go, work on healing my gut. And then maybe 6 months later, I can start to bring it back in, or maybe once in a while. So we identified food triggers, we reduce inflammation, we support the microbiome. We bring in the phytonutrients, all of those colorful vegetables that our cells need, all of those nutrients and vitamins and minerals. We're reducing toxic burden because we're talking about how to eat clean, when to eat organic, when not to eat organic. There's no calorie restriction. We're not counting calories. I want you to eat. I want you to eat lots of veggies, lots of fruits, protein, healthy fats. I want you to eat and not be deprived and not feel starved. And the most important thing that I think most people have shared, myself as well, is the concept of promoting awareness and really understanding how foods affect your body. And it really helps us make better choices when we know, hey, when I eat that food, ooh, that makes me feel gassy, but that's a choice that I can make. Or when I eat that food, I know that I'm probably going to have a migraine, but then that's a choice that you can make. Do I want to eat that and then pay the consequences for a couple of days? Sometimes I do, right? I'm at a party, maybe I'm going to have that piece of cake, but I know how it's going to affect me. And then I know I very quickly need to get back on to eating clean. So it just helps us make better choices on what my body needs, what your body needs, and your body is different from my body as far as how it reacts to different foods and what it needs. And again, it's not forever. So our goal is to bring back as many foods as possible, not the refined oils and sugars and the stuff that's not good for us. We really want to try to keep those out. It's impossible to always keep them out, but at least for 3 to 4 weeks, we've really got them out, and the body really appreciates that. So as I started running the elimination diet with some of my patients, very quickly, wow, my energy's better. Hey, my skin's better. My mood's better. I lost a few pounds. My gut's doing better. My feet feel better. And even a couple people said, hey, I feel like I don't need to do my medications as much. And again, you have to work with your doctor on that. That is not my scope. So it was exciting to see some of the results come in of how people were doing. And this was even before they went into reintroduction. Again, it's different for everybody. Some people have so much more inflammation that it just takes more time for their body to come to a better state of balance. But it was really encouraging to me to say, hey, we've got something here, and I really need to promote it more for my patients. But it's not easy. I've had some patients where very quickly they were overwhelmed. So I had given them the handout, okay, run with it. And there wasn't a lot of support and they were overwhelmed. I don't know what to eat. And I ended up at a party and I accidentally ate these things. Some people gave up early. Some people struggled with being out and about with other people. Accountability, it's hard to do it without accountability. Some people do. Some people did just fine. They did great. But distractions and temptations. So I had a handful of people who just weren't able to get through and they got frustrated and they gave up, which I don't ever want it to be frustrating because then that creates more stress, which creates another form of inflammation in the body. So objections, as I brought it to some people, it's tough, right? The concept of the elimination diet. And that's why I'm grateful to explain it to people. Like, just give me a few minutes to explain it and then we'll run with it. Why can't I just do the blood test? I get a lot of people who said, yep, I did the blood test and I'm allergic to cinnamon, this, all of these things. And sometimes I wonder back to that concept of leaky gut. So it doesn't address the concept of leaky gut. It doesn't address healing the leaky gut. And are some of those related to maybe some of the bigger food sensitivities? And then it doesn't promote awareness. So sure, I'm avoiding all those things, but it doesn't really help us develop awareness into the foods that we eat and what helps us and what doesn't help us. So how is it different from Whole 30? I have a lot of people who said, I did Whole 30 and it was okay, but I didn't really notice anything. Or I did Whole 30 and then I went right back into the way I was eating before. Again, that concept of really focusing on awareness and the reintroduction period. I don't like cooking. I don't like cooking. I'm busy. It's not fun for me. I set off the fire alarm all the time. So I get that. And that's why I've created this program to help you do it simply and easily. I have some patients, I'd rather die than give up sugar, or I'd rather die than give up wine. I've had people say that to me. And that's a tough one. And that one's a hard look in the mirror. Really, how are you feeling? If you're feeling great, if you're feeling good and don't have any issues, then all right, maybe you're doing okay with that. But if you're still struggling with some things, you might want to look in the mirror and try letting go of some of these things. And only for 3 weeks. Just do it for 3 weeks and see how you feel. And then you can make that decision to eat that or not to eat that. And many people, right? Once you go back, I don't want to feel that way again. So it's much more easier to let things go. I'm so busy. I'm super busy, but I found ways to make this happen and make this work for me. I already thought I'm eating healthy. Many people, we think we're eating pretty healthy until you really start to go through your refrigerator and go through what you're eating during the day. And it's amazing how many things sneak into our diet. Will I have enough to eat? Will I have enough energy? Yes, we'll have plenty of great food to eat and nutrient dense food. And then, as we talked about, I'm gluten free. Well, just because we're gluten free, let's start reading those labels and see what's in there. So that's why I created the power of food. So it's the elimination diet and so much more as we dive into food triggers, decreasing inflammation. It's all about nourishing your cells and really learning about how foods affect your body, really paying attention to the messages of your body, how your body responds to things, positive or negative. And the most important thing is support and accountability. So it's a 7 week program. It's 1 week prep, 3 weeks elimination, and then 2 to 3 weeks of reintroduction. And every week I have lessons posted that you can view at your own time. You can pour a cup of tea and sit with them in the evening. You can look at them in the morning, whenever you like, but it's your to-do list for the week. We talk about other things such as detoxification, how to cook your food. We talk about oils. We talk about all kinds of things to help support your cellular health and decrease inflammation and help you stay on track with eating clean. Journaling is such an important piece to see here's how far we've come. We've got a group Facebook page where I'll be sending, hey, here's what I ate today. Here's what I made today. Because a lot of times we struggle with, I don't even know what to make. I don't know what to eat. So other participants will jump in. Hey, I made this today. I got this recipe. So it's just exciting and we cheer each other on because it's not easy to do this. It's really not easy. But with the right support and trying to make it as simple as possible, it's doable and it's worth it. We do weekly live check-ins, so we'll have question and answers. You bring your questions to me and we'll problem solve anything we need to problem solve. And the time commitment, I'd say you plan on, if you're able to make the live Zooms, an hour to an hour and a half a week in the lessons and the question and answers. 15 to 60 minutes of grocery shopping. I personally love food delivery. That saved me a lot of time. And we do need to spend some time in the kitchen cooking, which is not my favorite thing, but when I'm in course, it motivates me to buy groceries and make fresh food for my children, which is so important because they need to learn those skills and see that as well. We talk this picture with my son. He's looking at Pop Tarts. Hey, mom, there's a lot of protein in these Pop Tarts. I said, well, read the rest of the ingredients, my friend. So it's all about, we dive a lot into reading the labels. Additional benefits, we talk about mindset and awareness. We'll talk about supplements a little bit. Detoxification comes into the conversation. Transitioning into real life, because I don't want you to stop this and then go back to what you were doing before. You worked so hard to get there and you felt so good. We don't want to go back there. We lessen the risk of genetic expression, as we talked about genes earlier. Just because we have a gene doesn't mean that it has to express. Like, for example, for Alzheimer's, doesn't mean that that gene has to express if we can keep our bodies healthy, keep the inflammation down low, and boost up the nutrients that we need for our cells. Food addictions, the Kraken, sugar. Sometimes it takes a few weeks just to stay away from those and to retrain our palate and not want to crave that salt, sugar, and fat as much. So, benefits of a healthy gut and healthy cells, there's so many, right? Let's slow down the aging process, that oxidative stress, that rusting that happens in our bodies with inflammation. As I mentioned, genes, GI, risk of disease, and immunity. And this will be the second time that we've run this as the power of food. And I just wanted to share a story from Stacy. She gave me permission to share. And she reached out. Her parents were undergoing some really significant health issues. She was struggling with her own weight and her own health issues, and just really was aware of how she wasn't taking care of herself. She wasn't eating well. She was grabbing fast food when she could because she was busy and taking care of kids and working and drinking Diet Coke. Okay, I'm trying to balance this out. And so she jumped in. We didn't get to see her much online, but she was busy in the background studying and learning and working. And we would email back and forth to help her problem solve what she was eating. And She had told me as we talked on the phone that she had done keto before, she had done Whole 30 before, but what was different about this was that concept of awareness. And where she says a little bit lower, she didn't really realize and how she learned about how the various foods reacted with her body and how she listened to her body's signals as she didn't before. And that's really what I want for everybody is to really get in tune with their bodies and to work with their bodies as far as, hey, here's foods that your body wants, here's foods that your body doesn't want. And it will tell you, and it will thank you when you do support it. So it was really exciting also to hear that she's like, Jen, I have lost weight and she's still losing weight. So when we come off course, it's hard to stay super, super clean, but we leave the course just with much more awareness of and conscientiousness about what we're shopping for, the foods we buy, what we grab and put in our mouth. So we just have much more awareness. And that's for me, it's important for me to come back into course maybe a couple of times a year. Okay, I'm going to go clean house for the next 6 to 8 weeks again, just because I've gotten a little sloppy after holidays and such. But it's really exciting to empower people with these skills and equip you with this knowledge to go forward after this course. So is this for you? So it honestly, it is for everybody, but it's a matter of you've got to be ready for it. It's not super easy, but that's why I created this course to help you get through there. Are you ready to make some changes in your diet? I've got some people where they're just not ready yet. And I often ask the question, if not now, then when? How are you doing? What's it going to take for you to really make some changes in your diet? Do you want to feel better in your body? Do you want to feel comfortable in your clothes? What are you struggling with that it's not really getting much better? Do you want to prevent health issues in the future? There's so much we can prevent by taking care of ourselves. Do you have a strong family history of genetics or disease that is probably knocking on your back door and we don't want to go down that road? Taking better care of our families. I want to be healthy for my kids. And I also want to model for my kids, which it's tough, right? There's the food that they're eating in the cafeterias, they go to parties, and I trust and I see little fruits that come. Well, sometimes they'll make a different choice. I mean, I'm on them all the time as far as, hey, what are the choices? Is this something that's going to fuel you and give you energy and help you be strong? Or is this something that's going to make you tired and grouchy and have your skin break out? And then are you willing to get in the kitchen and do a little bit of cooking and food prep? So this is the Power of Food course. We are going to be starting on February 3rd, and that first week is prep, and then we go 3 weeks into elimination and then reintroduction. So I'm happy to answer any more questions that you have about the class, but I hope that this is shine some light on how you can take control of your health and really support yourself despite the society and the world that we live in today that really doesn't support our health in many, many ways. So I hope that you consider taking this next right step towards building a healthier, more vibrant life. And if not now, then when? So on there is a QR code. You can scan that and that will take you right to the homepage of the Power Food. You can register there. And that concludes my presentation for today. And I would love to answer any questions that any of you have. I'm going to stop my share. Or if Jesse, if you would like to share a couple minutes on your experience while people are thinking of questions, you may do so.
Yeah, absolutely. Hi, everyone. I'm
I
Jessie, and I work with Jen. I do a lot of the back end for her with building the courses, not building the courses, but the making sure all the links work on the courses. And I met Jen because I was a patient of hers for physical therapy. And I initially saw her because I had really bad plantar fasciitis, really bad migraines. I was also working in a very toxic industry, the alcohol industry, and my nervous system was up here because I was constantly on the go, going to this event, doing this thing, like the whole gamut. Anyway, I decided randomly I'm just gonna quit my job. Didn't know what I was gonna do. Jen's like, help me. I'm like, okay. And I didn't help Jen. Jen helped me. Building these courses with her or taking the courses with her really helped me because I was so bad. My plantar fasciitis was so bad that I would get out of bed in the morning and I couldn't walk. I would have to hold on to the end of the bed and in order to get my feet moving and going. And I tell you, after taking Power of Food, it just went away. And I'm like, how is this possible? Like, reducing inflammation in your body really does work with your pain.
And I've worked on her foot a lot. I'm like, I am working on this foot. I'm working on these nerves. Jesse, we're working on your core. Like I've worked on her structurally. I'm like, girl, like there's some deeper things that I just can't get moving for you.
Yeah,
Couldn't get them
yeah,
going.
yeah.
Go ahead.
No, I was just gonna say, like, so I did the first Power of Food course that was in September, the first online one, and I took that knowledge. It really helped me through the holidays too. Now, did I indulge? Yes, but not what I would normally indulge. I might have had maybe a few things because I knew the signals in my body. I mean, even yesterday, I had my boyfriend's family over and we were celebrating. We didn't get to celebrate for the holidays and we had birthdays. And I was in the kitchen prepping and I'm like, oh my gosh, my feet are hurting, my knees are hurting. Why is this happening? Well, it's because I'm like, oh, I know I'm doing power food again. And I kind of indulged the night before. It creeps back in. So what Jen was saying, where you have to clean house, you really, really, really do. But there's always a bug in the back of my head. Is it worth it? Is it worth it? You know? So that's my 2 to 10 cents that I'll give you.
Thank you, Jesse. Thank you for sharing.
Mhm.
It really has blown my mind. Just as I've worked with patients and people who have gone through this, like, wow, 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 wow. It's really powerful to dive into just cleaning house and knocking down inflammation. And like I said, it's something that I need to do a couple times a year to just clean house because things creep back in. And for me, here's my genes, here's my destiny. Mom, I don't want to go down that road. And I really do. I feel so much better. I feel much better at my clothes. My energy feels better. I've really overcome some things that I've struggled with regard to mood. And I can tell when some of those foods creep back in my body or I start bringing in those oils and sugars that I don't feel as good. So it really is that awareness of noticing how your body feels and then realizing, oh, hey, what's snuck back in my diet? What do I need to clean house again on? Any other questions that I can answer for you on anything? Cellular health, leaky gut, elimination diet.
Hi, I have a question
I see
about
food.
leaky gut. I know you
Yes.
said that you can develop food sensitivities
Mhm.
from food going into your bloodstream, and then your body creates antibodies thinking that it's like an invader. Is there ever, or would your body ever stop recognizing those foods as bad? Or is that kind of a permanent thing that your body now just you can't really tolerate those foods?
Right. So the goal is to remove it for a while and then have those antibodies decrease and then avoid that food for a bit. And the hope is as we dive into restoring the gut. So in functional medicine, it's called the 5R program, and we talk about it a little bit in the power of food. So number one is remove, so removing everything. And then the next couple R's are about restoring the gut lining, which through the nutrients, we're trying to restore the gut lining. Sometimes we need to bring in supplements to restore the gut lining. And then we also address the microbiome, which we're doing, which that's the good bacteria, bad bacteria balance, which we're doing through food, but often we need to supplement with a probiotic, prebiotic, which we talk about in the class as well. So often the hope is that as you restore that gut lining, you restore that balance, you lower that inflammatory load in general, that eventually you can tolerate it a little bit. So I don't want to say I lost, but what was inflammatory to me when I did elimination diet was eggs and peanuts and corn, which is tough because that really starts to eliminate from things, but that's how bad my gut was. So I find now down the road that I can do a little bit without having a big response. So I feel like we can, again, and like I said, we got to be super careful with like the IgEs, like where you could go into anaphylactic shock, like you work with a doctor really close on those. But for some of these food sensitivities, can I tolerate a little bit? Sometimes it's something where, you just know I shouldn't eat a lot of it, or you'll know, okay, I eat it 3 days in a row. That's too much. Okay, this is a food that I can only eat once, maybe like once every couple weeks or so. But I do think my son has a chicken kind of borderline IgE allergy. And so it's hard because he's 16 to do this. But what I'd like to do is, hey, let's clean house, which is hard to get him to clean house, but almost maybe like, can we microdose a little bit to get his body used to it without creating that inflammation? Does that answer your question? It's I
Yes.
can't say with 100% certainty that yes, it totally goes away 100%, but we were able to reduce how much the body reacts to it.
Okay. Thank you.
Mhm. Anything else I can answer for you? All right. Thank you for joining me. And any other questions, please shoot me an email. I'm happy to answer any questions that you have on all things and everything. You know, I'm a curious critter and I love to share lots. So thank you for joining me and I will see you all soon. Take care.
Thank you.
Uh-huh. Bye-bye.